Kentucky's hunger problem is getting worse. Map the Meal Gap, a yearly report from Feeding America, shows that food insecurity in Kentucky is the worst it's ever been.
To be food insecure is that you don't know, literally when you wake up in the morning, you don't know whether you're going to be able to eat or not, which is quite different because a lot of times people will talk about hunger and food insecurity simultaneously. But food insecurity is you don't have access to fresh food when you want it and when you need it, and you don't know when it's coming. We haven't seen these kind of numbers since the Great Recession in 2008.
It's up about 6.5%, 7%. It's the worst numbers we've ever seen in the history of the research. It shows across the Commonwealth of Kentucky is that 1 in 6 Kentuckians are food insecure. Here in central and eastern Kentucky, it's 1 in 5, and 19 of the most food insecure counties in the United States are here in central and eastern Kentucky, and in those 19 counties, it's 1 in 4.
Factors that contribute to food insecurity are numerous. In terms of one, the number one driver we all know is aware of is poverty. Poverty drives food insecurity, but along with that, you have housing or lack thereof, lack of access to housing, lack of access to education, lack of access to health care. And these what are known as the social determinants of health. When you don't have those things, that's when you experience the food insecurity in your community.
In some instances, we've seen an increase over the last couple of years due to reduction in federal benefits coming out of the pandemic. Maximum allotment of SNAP, child tax credit, and the stimulus checks that many people benefited from during the pandemic. When I think about the work that is necessary to successfully reduce food insecurity to help address hunger at the federal level, we need a strong farm bill, one that is relevant to today. The farm bill is passed about every 5 years. Right now, the federal government is 2 years behind passing the next farm bill. The nutrition title authorizes and helps pay for SNAP. It helps pay for USDA food programs. The Ag Committee in the House recommended a $300 million cut to SNAP. And they also recommended, that's federally, and they recommended that those benefits be transferred to state authority. The Commonwealth of Kentucky cannot afford, right, to be able to cover federal benefits.
The public sector and private sector are not going to be able to make up the gap. To give you an example, $1 that's invested at Dairy Care in a food bank is going to provide 2 meals for each dollar that's invested. For each SNAP dollar, it's 9 meals. We could have all the philanthropy and support in our community to be provided for us, and yet we could not make up that gap. We realize that cuts need to be made. Things need to be improved. I believe every person recognizes that. But to the degree that these cuts are being proposed, it's unimaginable in terms of thinking of the impact that it's going to have on the most vulnerable population. It's going to take a while, years to recover if these cuts go through, years to recover from it.
Other safety net programs under the Farm Bill that could lose funding: the National School Lunch Program, the Commodity Supplemental Food Program, which provides food to low-income seniors, and the Emergency Food Assistance Program, which distributes food to food banks, food pantries, soup kitchens, and other emergency feeding organizations.